Depending upon that, depending upon the funding, it can range anywhere between 35K to even 50 and 60K when you're working as a research based physiotherapist. Things like you can do workshops, you can do teaching classes, educational classes, etc., etc. So yeah, depending upon the area where you're practicing, that also decides the salary factor. So hi everyone, this is Dr. Uneza and I'm a physiotherapist, educator and creator, and this is episode 4 of the series called All About Physiotherapy. And since in this series we are talking everything about physiotherapy, this episodes will talk about the salary part, that is how much we as physiotherapists earn. Previously, in the last 3 episodes, we discussed everything like the history of physiotherapy, the challenges that comes with physiotherapy, and how to become a physiotherapist, how much we study and everything. So you can go watch these episodes. The link is there in the description box. So for the today's episode part, I'm going to first like talk about physiotherapy is little challenging. I talked it about in the challenges section as well. When it comes to the earning and the salary part, physiotherapist actually like a graph which having two extreme ends, because when it comes to physiotherapy and physiotherapist, we are earning as low as 15K per month to as high as 2.5 lakhs per month. And that's the reality of it, and this disparity and this much variation is there, which has so many factors like how you practice, where you practice, and your skills, your qualifications and everything, and so much more. So one by one we will talk about that. Firstly, we'll talk about the salary in the private sector, that is private hospital. This comes in the lower extreme of the salary section or earning part, because in private hospital in general, private hospitals, the employees they earn little less, and when it comes to physiotherapy and physiotherapists, we are no exception. All right, so we're working hard, we have a lot of patient load, we are seeing all the patients, OPD, IPD, ICU, everything, yet the pay scale is, it ranges from 15K to 35K, and in some hospitals who have a little bit more experience, they can earn up to 40 and 50K, but that's all. They have a capping when it comes to private employees. There are physiotherapists who are heading the departments. I will say that those are the ones in these private hospitals who have the capacity to earn more, because they usually work on sharing basis or outsource basis like that. But the employees, they don't earn as much. So this is the section having very low pay but more opportunity and vacancies, because private hospitals are so many and they require employees because of the patient load that comes there. Talking about then the government section part, I will say that we have then government hospital vacancies as well. Every year, every 6 months, the vacancies keep coming. So there are lots of vacancies in government sector, definitely. And for as now people and government and all the bodies, they are recognizing our value and our need, they're creating more vacancies in their departments, including the ministries, hospitals, and other setups where the physiotherapists are required and where healthcare is there. So that section, the government section, the salaries are better, I will say. Not so good extremely, obviously, but better. Okay, so in that section, people are actually getting a permanent employment status. They will get the benefits like the health scheme benefits that all the government employees get, that is fully, funded. Will get the additional advantages as well, like TA, DA, family cover, all such things. They get the what you call when the scheme comes na, seventh pay commission, eighth pay commission. So they will have that increment. Along with that, they will have with experience change in the post and updation of their salary as well. So yeah, definitely those, that government sector area is going to pay you more and having a more stable job as well. So you can look for that section when it comes to the salary part as well. Then there are so many other physiotherapists who have their own clinic, who have their own setups, and I will say that that is the area where people are doing so much well because they're earning well in that area. They usually need an initial investment, but the setup depends completely on you. You can make a fully aesthetic, nice, very good, what you call fully developed setup as well initially, putting so much money into it. You can also start with the smaller setups. Okay, so make a small setup initially if you don't have so much of money. Then you can put money as you start making more and more money into it. So clinical setup is also a very good option because there people earn so much money once their name comes, once people and patients starts coming to the clinic and they start getting a stable inflow, the earning there is so much. You can then later on think of even branching out and opening other clinic by the name, expanding it, and so much more. So definitely that is the area where the earning is ranging from lakhs. People are actually making lakhs in that area. And from clinic only you can do so many things, like you can do workshops, you can do teaching classes, educational classes, etc., etc. And then comes your fourth section, which is your home visit, home care, home based physiotherapy, whatever you call it, because that is also a very good option. It's a gold mine for earning, I'll say, because that has a lot of money. You can charge anywhere between, depending upon the area where you are living, that we'll talk in the later part of the section. But yeah, you can charge a lot, and patients pay also when they are in need and when they want to get the physiotherapy treatment done. So if you are doing anywhere between 3 to 4 or 2 to 3 home visits as well, you will make more than a private employee will do in a month. So definitely that section is also there, and home care physios do earn a lot. I will say that. This all was about the clinical practice, but when you talk about the academics part, then I will say that also it's the same scenario. Like private employees or private assistant professors start little better than the clinical physiotherapist in a private sector, like 35K, 40K they will get, but that is because they have MPT as well. Okay, that was about the clinical part, how much the clinical physiotherapist earn in private hospital, in government hospital, in their own clinic, and in the home-based physiotherapy. So from ranging from 15K to 1.52 lakhs and even more, you can earn so much, and in this range or in this bandwidth, anywhere depending upon the way you are practicing and your experience and skills as well. This is a major part that decides the salary of you and your earnings when it comes to physiotherapy or medical or healthcare part. All right, then comes your academic part. In the academic section, what is there is that the private sectors and the government sector, that is also there in the academic section. But for the academic purpose, like when you want to pursue a career in academics, you're supposed to have a specialization. You're supposed to have a MPT degree. That is a must. Okay, and some universities also ask for PhD, but yeah, after that the pay starts a little better, but you have already put in so much years also in that. So I will say it's a choice. If you don't want to be a clinical physiotherapist and go to academics, and be straight about going to PhD and all, because the government vacancies, they're very less when it comes to AP and academics. You can opt for the private AP as well. Scope and growth, I will say, is not so much, because becoming an associate professor and professor, it takes a lot of time, energy, and years. But if that is your passion, you want to pursue that, then go ahead. Maybe you'll get a government vacancy right away in between all your practice and teaching, and you can opt for that definitely, and it'll help you also. So I will say the choose from the very starting what you want to go, a clinical physiotherapist, an academic one, or then the third part come, which is your research. So coming to the research part, I will say that there are physiotherapists who are actually doing very good when it comes to research as well. And when it comes to the research based physiotherapists also now, who are working with the clinical trials teams, hospitals, and all these institute and companies who are doing research and all, they are also earning good. They can be hired as a BPT as well, they can be hired as a specialized MPT as well, and it depends upon the project, the funding, etc. when it comes to their pay, because they may hire them as like contractual for 6 months, 3 months basis, for a year basis. It can be a permanent job as well. Depending upon that, depending upon the funding, it can range anywhere between 35K to even 50 and 60K when you're working as a research based physiotherapist with the teams and clinical trials. So I'm going to quickly summarize this for you, the salary part of physiotherapist. That is, when it comes to clinical physiotherapist, you have private hospital, government hospital, as well as clinics and home visits. In that, you can earn in the bandwidth of 15K to 2.5 lakhs as well. Then you have an option to become an academics physiotherapist, that is assistant professor, etc. For that, you will require an MPT degree definitely, and even a PhD in certain institutes and universities. The government options are less as compared to the private ones. Private ones offers a little better salary when it comes to MPT working in clinical aspect. So yeah, you can opt for it as well, depending upon your passion, your dreams, and your interest. And you can look for searches as well while you are pursuing an academic career. Then comes to research based physiotherapists, who are working with the clinical trials, hospitals, teams, etc. to formulate new treatment protocols and all these things. Their salary basically depends upon the funding of the project, as well as their qualification, their experience. And they also work on a contract basis, and it's not a permanent job most of the time. When it because the project ends, the need is not there only for the physiotherapist. So opt for it will like little by making proper assessment about it. If you don't have any option for the time being, you can definitely opt for that option. So these all areas you can work as a physiotherapist and earn. Apart from these, you can also like earn as a part-time physiotherapist, like mix and match. That will work better for you. Like instead of working full time in a hospital, you can do a part time in a clinic, part time home care physio, and become a content creator or follow your passion and things like that. So I always recommend that for physiotherapists to mix and match and do two three things rather than depending on one sole things. Because I read a quote somewhere that said if you are working full time in a company and doing that one job, then you're just one step away from becoming poor and hitting poverty. So definitely having an option is always better and best when it comes to earnings, and try to do that. Now this was about the salary disparity sectors, etc. There are another point that I would like to you all to notice here, that this earning section also depends upon the city that you are practicing in. Peripheral area like a village or something will definitely have lesser opportunities, low paying capacity, and lesser consultation fee as compared to a metropolitan city like Delhi, Mumbai, Bangalore, etc. Because there are people who are earning more, paying capacities more, and you can charge them more consultation, even for that matter for the home visits as well. So yeah, depending upon the area where you're practicing, that also decides the salary factor. And apart from that, your skills, your knowledge, how you communicate with the patient, how you treat the patient, and how the patient gets benefited from you, because then you will get more referrals, more patients, and that will make you earn more and more money, right? So your knowledge, your skills, the area that you're practicing in, the sector that you're practicing in, all these things decides the salary of physiotherapist. And trust me, there are so many physiotherapists who are earning so well, they're doing very very well. And you can do well too if you work on yourself too, I will just say that. Coming to the low pay when it comes to private hospital, etc., I think that scenario is going to change soon, because we have had a council set up recently, and these guidelines which were there na, these level of pay which are there, they're very old, and they have been there as per our previous qualifications, which was diploma in physiotherapy. So definitely once that gets updated, become bachelor or master in physiotherapy, then the pay scale and level of pay in government as well as private sector will change. We are hoping that because things are changing, it will get in line in a few years ahead. Until then, hold tight and do what you can do best. And at the end, I always say that if you feel that this is not something that you can do, if it's too challenging for you, if you are not able to find your way, then it's always best to look for other options, career paths, rather than regretting your entire life. This 4 or 5 years degree is a useful tool for you. It's a bachelor's degree and it can work as a qualifying criteria for so many other things. So use it. Do not get trapped inside it. Okay. So yeah, that was about the salary part of physiotherapist. In this episode, we talked everything related to it. If I missed a point or two, or if you want to add something, you can add in the comment section. Definitely. I'll be open to get recommendations from you as well for the new videos. And don't forget to subscribe to my channel and like, share, and comment on this video so you never miss a video from cardiopulmonary rehab. See you next week in episode 5 of All About Physiotherapy.